Welcome to Inside Aesthetics, the world's leading podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, an aesthetic doctor with over 16 years experience in facial aesthetics.
And I'm David Siegel, an entrepreneur and business mentor with over 20 years of experience in our industry. Our podcasts are aimed at industry professionals, and any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
You can also subscribe to us on Patreon for on-demand content for injectable and business education.
Welcome to chapter 26 of the Injector Diaries.
It's pretty mental, isn't it?
It is 26. 26 episodes of Injector Diaries. They're my favorites because we get to know people. There's always interesting stories that come up. And today we're joined by someone quite interesting. And Jake, we met this guest late last year at an Alma event.
Yes.
And we were introduced to Dean, and we'll sort of formally introduce you in a moment, at the event that Alma was holding in Thailand. We were there as, roaming reporters, for lack of a better term. And we caught up with you. We sort of got on like a house on fire. We were sweating profusely at an outdoor dinner in Thailand where Alma asked us to dress formally in 900-degree weather. I was in a three-piece suit. But it was a great night. We had lots of interesting discussions with yourself. And you've got a really interesting background. But Jake, you want to cast your mind back to sort of, was it October, November last year?
Yes. And actually, this is Dean's second appearance on the podcast because he made a cameo in episode 277 when we covered the Alma Academy. So
right, he did too.
He has already been on the podcast, but only for about 10 minutes, I think.
Ah, there you go.
But yeah, I think, yes, we obviously got on with Dean, and Dean's been to Australia since to launch Alma's fillers, so the Reveness range of fillers. And he did a training event that I had the privilege of observing and, watching how Alma do fillers here now, which is new for them.
Mm-hmm.
And I'm really looking forward to this podcast because Dean's got a great background, and I think he'll be our first true medical director of a global brand where we're going to get into, well, what does that role involve? It's certainly busy. I know Dean's flying all around the world most of the time, attending various events and ad boards and conferences and so on. So I'd love to find out what his role actually involves. But anyway, let's introduce him back to the podcast. So Dean, tell everyone who you are and a little bit about your background.
It's really nice that you set the expectations so high, so I'll be able to drop everything downwards. Good morning from Vienna. I know that it's evening time for you, but good morning from Vienna. As you said, my name is Dean Berman, and I have many hats, honestly, but one of them is, as you mentioned, the Global Medical Director for Alma Lasers. But I'm also, a simple doctor who's trying to make his earn meets every day. Very, very pleasant to be here.
And Dean, you said you're in Vienna, but where are you from originally?
So from my mom's side, she's Portuguese, Brazilian, English, like nice mix to it. And my dad's side are German, Israeli. And I'm originally from Israel. I moved to Vienna 8 years ago, and prior to that, I lived in Germany. So I actually moved here for work. I crossed to the dark side from being a physician that is dealing with aesthetics. My first international role was for Merz, where I relocated to Germany, to Frankfurt. From there, I received an offer to move to Austria to become the chief medical officer for Croma. And I did that, and I'm very happy because I met my partner here. Afterwards, I had a role in Galderma. Now I have a role in Alma, but I stayed in Vienna ever since.
Well, you've got a really varied background, and you've done lots of different things. But maybe let's rewind to the beginning. Maybe let's start even before medicine. Like, sort of, what was your early childhood like in terms of you growing up in Israel? You're moving around. How'd you find yourself in medicine? And then, I guess even one step beyond that, how did you find aesthetics?
I come from a large family. We're 7 kids.
Yeah.
Perhaps, when I look at my parents as a role model, I think that I was probably one of the luckiest person in the world because I've never in my life, even until today, have seen a couple that loved each other as much as my parents did. They were first boyfriend, first girlfriend. They met when My mom was nearly 15. My dad was nearly 17. And they truly loved each other. I mean, I'm saying it because my dad passed away 23 years ago. But, as a child, I remember how embarrassed I was because my parents always French kissed each other. Or they worked together, and yet my dad would send my mom a fax every day to tell her how much he loves her. So it was very endearing. I grew up in a really supportive and loving environment. And I was sure actually for many years that I'll be an animator. I love drawing. If you could see my screen, you would see here the tablets, the drawing tablets and everything. I still love drawing. It's part of my 2025 New Year's resolution to draw more. But then I guess around 15, I started volunteering in a local ambulance station. And I pretty much fell in love with the whole medical aspect. We've got zero family in the doctor. We come from a long line of hypochondriac, but zero doctors. I took over the first of the family, perhaps the last one, because I wouldn't recommend it to anyone in my family. I get a daily call by one of my 7 brothers and sisters, with certain problems. I have 16 nieces and nephews with loads of problems to ask me on a daily basis. Loads of fun. Highly recommend it. That's it. So I've studied medicine, and then I thought that I'm going to save the world. That was my ideal concept. Save the world within oncology. That was my true passion. I started with internal medicine, and as part of it, I like smiling. This is like one of my features. Most of the time, my default is a smile. And therefore, I was sent, of course, where do you send the smiley people? To the worst scenarios ever. And I was, among other, responsible on the young terminal oncology patients. As a nickname for my smile, my friends used to call me the angel of death. Because I would sign a week on average 8 to 10 death certificates. It was an awful time, really awful time. I would return home every day crying. And then my mom had her 6th birthday, and I've asked her, of course, what she would like for her birthday. And she said that she read in a local magazine like a Cosmopolitan or something about this new hyaluronic acid that will make her look younger. And if I can ask some of my friends who is using it. So I did. I've asked some friends, and they told me not to be an idiot, to take a course, to enroll on a course, to bring my mom as a model. She'll be happy. I'll learn something new. It's a win-win situation. And that's what I did. The course took place on a Friday morning in a beautiful setting. By the end of the course, after my mom had a smile on her face, thankfully, the teacher there asked me to stay, asked me if I would like to have a second job, because apparently I knew anatomy better than him. And that was actually my step into the aesthetic industry. And as time passed by, I realized that I want to spend less time with the oncologist patient and to be surrounded by pessimistic and death, and to be with smiley patients where they are healthy and I help them become happier. It continued and continued. My head of the department, I'll give him to that, saw that he's losing me. So he said, okay, I'll send you. He was infectious diseases. So he said, Dean, I want to send you to the US to bring one of a product that is intended for HIV patients, to teach the rest of the people in the department. And that was Sculptra. I mean, joke on him, because, first patients arrived, it was an HIV patient with lipodystrophy in the face. But the third patient was already a young lady that wanted the refresh gluteal appearance. And that was literally my last day in internal medicine. and never looked back. That's my story in a nutshell.
What's most fascinating about that story, Dean, is the guy who was teaching you said you knew more than him. So it just shows where the industry was at that time. What year was this?
Wow, that was ages ago. We're talking like 14 years ago, 15 years ago.
Yeah. Was it like a third party or is it an actual company teaching you? Like what did you learn on the day?
Honestly, I've learned very little at the time. It was an independent dermatologist, right. No name dropping here, that, wanted to earn some, I guess, extra money on the side.
Yeah.
Which was very common at the time.
Still is.
And when I reflect on it, I think that was the only options, because afterwards, since I really liked it and, with food, the appetite just increased, I started searching for other areas where I can find courses. And it wasn't easy at that time to find really proper courses. So most of the teaching, funny to say, I read books. Yes. It was an invention at the time. People read books. Online, there was very little, if any. And the best way to learn was to approach companies and to ask them to teach you. So if they had any workshops or anything, but obviously it was all very sponsored and all depending on the products that they wanted to sell. It took me a few good months afterwards to find the first official course that I took. And that was 3 months. And at the time it sounded like, wow, now I know everything. But that was the only thing available. And once I started to search outside of the country, that's when things started to get much more interesting.
Yeah.
And I spent all of my money basically that time on flying around the world and learn from other doctors, shadowing other doctors, being very, very curious. Thankfully, as I said before, I have a large family, so my guinea pigs were really nice number of guinea pigs. I have sisters that I like more, sisters that I like less. You can imagine what I did to each one. But until I found my comfort zone, that products that I liked more compared to others, protocols that I was brave or stupid enough to try, to see whether they work or not. But the learning curve was fantastic. I mean, I enjoyed every part of it. I have one sister that enjoyed it less. But that was what was available at the time.
Yeah, it's tricky, isn't it? Because we tell people do courses, seek experience, shadow, blah, blah, blah. But you're kind of making it up as you go along. There isn't a path. There isn't a good way of doing it. You just got to absorb.
Yeah, there's no real program. Until today, one of my biggest passion, always have been, but with time it's just increasing, is education. So this is what I do, or one of the largest part of my role in the past and today. For Galderma, I was head of training and education. It is what I love. There's nothing that I love more than sharing knowledge and teaching other healthcare professionals regarding what you can do, because we have an enormous privilege. We get to work with healthy individuals and to make them happier. I mean, what other field in medicine can do that? I mean, obstetrics to a certain degree, but we are the lucky one, and it's amazing. I mean, it's part of the reason why I literally go to work every day with a smile.
Yeah, totally agree.
Yeah. Double-edged sword though, because sometimes taking someone that's healthy and trying to make them happier might be more difficult than curing someone that might have a disease or something wrong with them. I think a lot of injectors sometimes struggle with the expectations, the high demands. We have our own sort of challenges in this space as well. How do you sort of compare that in terms of, the patient that finds that?
It's really true, when a patient is chronically sick and you can improve them by a little bit, they are very grateful. when an aesthetic patient is coming, as you said, their expectations can be tremendously high. And while you can improve them, they in their head would like to have something else, something more. That can be tricky. I mean, patients selection is so important. And I think, Jack, I'm sure you'll agree that today we can spot them from a distance, and we can tell who should be our patients and who should not be. I mean, the red flags, etc. I had a plastic surgeon that used to be my professor years ago, one of the funniest guys I've met. And he always taught me that he is the king of saying no, because patients would come to him and he would say in front of everyone, you're very, very lucky. There are 520 providers only in this city that will probably say yes to you. Unfortunately, you came to the only one that will say no. I like to think myself as the prince of saying no. Because I do say a lot of no. I mean, I take a lot of time to talk to patients, to explain to them the logic. So I look at it as patients' education, to teach them, to explain to them. In most cases, it works, but many times they simply don't understand. And then I will not do something that I don't feel 1,000% full with. I need to understand on my own the why and the hows, and only then I'll embark on this patient's journey with them.
Yeah, I mean the key, what you just said, is you take a lot of time. Sadly, a lot of clinics, because they're corporatized and commercialized, it's quick. There isn't much of a consultation, and it becomes transactional medicine. I think that's where things fall apart. And especially with new injectors, they're thrown into a situation where they've got 15 minutes to make a decision, do a treatment, and get them out. David's sort of seen that in his old life, and it doesn't work, does it?
Well, I think as we've realized how complicated this industry is, I think there was an oversimplification of what it was, even though I'm not a medical provider, just being around it. I think there was an oversimplification of what it is that you guys and girls do. And I think that's part of the problem. And as you said, corporations get involved and everything becomes about the bottom line. And it's always difficult, separating money in medicine. I mean, you need money to come up with innovation and to pay companies to do studies. And without money, there is no innovation. But then how do you kind of balance that off against not trying to oversell and not trying to maximize profit from each patient? I mean, I don't know the answer, but it's definitely a challenge. What do you think, Dean? I mean, what do you have?
I think there is a huge investment, as Jack said, that you have to do. I am fortunate enough that most of the patients that I take care of are not new patients. So they really went on this journey with me, and we continue to do it for a very long time. But yeah, it is an investment. It's an investment, from the patient side, obviously financially, but not only. It's a lot of time, a lot of energy. We are, in many cases, in order to achieve the results that they are aiming to, we can't do it in a one-time session. It needs to be multiple times. They need to return. We need to build things. We also build the trust in between themselves and ours. With the right patients, it is fantastic. This relationship is unbelievable. But when you throw under the bus someone for 15 minutes and hope for the best, I don't think it's a recipe for best outcome.
Yeah. Talk to us about your consultation process. I mean, a lot of the conversations that we have on this podcast are always focusing on the technical side, different treatments, products, new gadgets that are coming out. But the consultation process seems like the lost art, or the art that isn't really appreciated enough. So talk to us about your process.
I really like to take the time to get to know my patients. As I said before, I don't get many new patients. I really know the majority of my patients. And then the consultation each time is tailor-made specifically to what we are going to do. But let's say a new patient, hi, David, nice to meet you. And I want to know who they are, why they are here, what is bothering them. But I want to know background. I want to know, what do you do for life? I want to know, what is your current status, how stressed you are. I much look into the holistic approach of everything surrounding your life, rather than you coming here to tell me I want to rejuvenate my hands. Okay. I want to know why you want to do it, but what brought you here, and have you seen any results on others that you like, or did you get any comment recently that brought you here? I think it's equally important as explaining the step-by-step of the hand rejuvenations procedures. Jack, I see that you nod, so and I've seen you in action, so I know that you follow same regimen. Right? Exactly.
Yeah, I totally agree. I mean, it's a tricky one as well, because some patients, if it's not done delicately or in a way that feels sort of, friendly, it can feel a bit prying. And why the hell are you asking me if I'm married? And why do you care about my job? Like, it can feel a bit forced if you don't do it in a way that feels friendly and natural. But also, I think it's valid enough to explain to a patient, I'm asking you these weird questions because I really want to do the best thing for you. And the best thing for you is knowing who you are, and so on. So try and explain why you're asking as well.
Yeah, totally agree. The whole concept of customizing the treatment is not just to make sure that I select the right product for you, or the combinations between the right lasers and the right injectables, is to really understand you, to understand the downtime that you are willing to have, that you can allow yourself to have, the reactions that you want to get from others, or perhaps you don't want to get from others. I mean, there's so many elements to this discussion that you need to keep in mind. And I think that patients really appreciate that.
Yeah,
this is, as you said, perhaps it's the old art of evaluation, but this assessment is super crucial in order to have best results. We have some, the frontal discussions that we've got is, in my opinion, the most important part, because we use, we talk, we use our eyes, we listen. And today you've got wonderful technologies, of course, that are helping us as part of the diagnostics process. But it all needs to be together.
Yeah. Which instruments or diagnosis tools do you have in your clinic? Do you use special cameras, 3D, or anything else, skin analysis?
Yeah. So first of all, my eyes are my favorite camera. But with Alma, we are launching now a new product that is called the Alma IQ, which is a camera that both takes face, neck, all the way to the décolletage. But I take photos. One of my biggest learning of the last years was to stop just taking photos, but to take short videos. I'm asking my patients to do different movements with video, with really to see the mimic and the animations. I find it to be super helpful for facial treatments.
Yeah, it's a good point. When they come back after their tox and they make this weird face and say, look, I've still got lines. And you're like, well, that's not a normal expression.
Do you know what is the most common disease among aesthetic patients?
Go on.
Amnesia.
Yes.
They never remember how they started. Never remember. So it's really up to us to remind them by taking photos and videos. And it's like, yeah, well, guess what? You weren't born this way. Okay. But it's super important.
Yeah, well, that's a good reminder of a recent podcast we did of doing some sort of photography or documentation, however you do it, get that record. Because like you say, patients don't remember shit.
Yeah.
And
absolutely.
You get just from a consultation perspective, but potential legal perspective as well. So it's important.
Yeah.
Yeah.
So you've been practicing aesthetics for around 14 years. And as we said, you've worked for lots of different companies. So at what stage of your career did you start transitioning into these types of, I guess, job roles, and what made you think that you even wanted to do it, and how do you go about it?
So my first role, so as I mentioned, I started to become a teacher. So to teach doctors how to work, and to teach nurses, how to work. And I must say, I loved every part of it. I mean, you need to change your hats in between, and obviously the curriculum is very different. And then in one of my classes, the beautician classes, I had a student that towards the end of the course, which was like a 6 months course once a week, told me, my husband works for a dermal filler company, and they're looking for a trainer. And I told him about you, and he said, you should apply. And I was like, yeah. And then she asked if she can have my email. I gave her my email. I expected literally nothing, but I received an email from Merz, and we're talking about global Merz. And then my first interview was by Skype. Yeah, do you remember that?
Yeah.
My first interview was by Skype. I really didn't think they're serious. I mean, what are the chances? But I had a very nice interview at my mom's house. I didn't even went home. I thought that it was not serious. So it was in between visiting my mom. But it was a really nice discussion. And then at the end of the Skype conversation, they sent me an email with a task. They wanted me to pretend as if I have a device that can do whatever I want, and I need to teach them how to operate this device as doctors. And I created this completely imaginary device called Aurora. I can't recall what exactly it did, but apparently it was very impressive. And like 3 minutes after I started, they asked, okay, do you mind doing these presentations in 2 days in Frankfurt? And I found myself in Frankfurt a few days afterwards, giving the same presentation. Walking down the stairs from the interview, they already called me to ask me if I can stay 2 more days. I couldn't because I had patients waiting for me. But they did call me to tell me that I got the job. And I became the head trainer for EMEA, for Europe, Middle East, and Africa. This is how I crossed the line, and started working for a company. And it was fantastic. It was really interesting. You get to know people from different mentalities, countries. You understand that even though there is a common line between everyone, there are also some differences, and you get to learn those differences. And I think that was such an important part for me, because you understand that the people in Spain are slightly searching for something, and the people in Germany are looking for something else, and the people in Israel are it was so interesting. And then, this is how it all started. Super interesting.
So what commitment did you have to give them? Because obviously you're still running your own thing back at home.
So I left the clinic that I worked. I was very young and stupid. Today I'm just stupid. But at that time, I literally closed the clinic. Within two to 3 weeks, I closed everything. I sold everything that I owned. I did like a garage sale for whatever I got, from a refrigerator to... I left my apartment in Tel Aviv, which was perhaps the only thing that I regret, because I got a really cool apartment in a really cool place in a decent price. You can't find that today. And I left. I moved to Frankfurt. I did a very ballsy decision. Would I do that today? I don't know. I really don't know. I'm super happy that I did that. I follow my gut feeling. It was very brave. I couldn't speak German at the time. Today, yay, ich kann Deutsch sprechen. But I couldn't speak German. And that's it. I mean, I'm super happy that I did that, because my life would look completely different. But as part, it was very important to me that regardless of where I went, I always continue to work, because, the tools that I've got, among others, are my two hands. I feel I would feel very ashamed to talk about injectables or on lasers if I couldn't work with them, operate with them, get the right experience. When I talk about something, I don't talk about something that I read.
Yeah.
I talk about what I do, about the experience. Today for Alma, I create protocols that combines energy-based devices and injectables. And it's fantastic. And it's really the future, because we're talking about same-day procedures, etc. But everything that I talk about comes from the experience of what I see in the clinic and what I see with patients.
Yeah. So I understand your next role with Croma and then Galderma as medical director. Is that correct?
So for Croma, I was the chief medical officer, and with Galderma, I was head of training and education.
Right.
So different aspects, but a lot of similarities in all different roles. And the global medical director today for Alma.
So chief medical officer, is that similar to medical director?
Yeah, kind of, tomatoes.
So, I mean, what does that role mean for people who maybe have never worked with pharma, or they've never met a medical director? What are your actual duties? What are you doing?
So duties really, so on the one hand, those are studies. Okay. So you work to help create preclinical studies, post-marketing studies in regards to different products. On the other hand, you evaluate products in development, or sometimes products that are not manufactured by you, whether it's OEM or something similar. So you need to evaluate. You need to help create protocols for existing products. The training and education, so it's part of your responsibility. How to train, how to find key opinion leaders, KOLs worldwide, how to build faculties in congresses, how to create a symposium, what should be the next interesting things. So to predict trends, to be aware of trends, to be aware of what other companies are doing, because there is a competition between companies. So there are many hats to wear during those roles. I find it fantastic. I love it. I think that, for example, KOL development is one of the things that I love the most. I love nurturing new talents. I wrote about it 2 weeks ago, that LinkedIn reminded me that it's been 12 years since I gave my first lecture in a big congress. And I feel such an honor to be able to pass the torch today. We just returned from IMCAS yesterday. And I had a few talks there, but I had two new KOLs that it was their first IMCAS appearance, debut, and they were so nervous. And I felt like a very proud dad. Not only that they were both fantastic, we exercised before, we did a rehearsal, we did different scenarios. It really fills my heart with joy and pride when I see doctors speaking on those congresses. I've been there. You were there, so you know what I'm talking about. It's a world of joy.
Yes, it's a tricky pathway, and you're almost picking a personality as well as a good doctor or a good injector, because without that, I guess, stage presence and charisma and funny and all the rest of it, it's sort of hard to get your message across, certainly to thousands of people in an auditorium like IMCAS. But how do you choose a good KOL? Like, what are you looking for?
I think that knowledge goes without saying. I mean, you won't use someone who doesn't understand the product, the pathophysiology. So knowledge is a given. Then obviously their communication skills. English might help.
Yes.
Okay, true story. During IMCAS now, I met someone that I've seen on social media and with fantastic results. And I went to introduce myself because this is what we do, to realize that he can't speak a word of English, a word, not even hello. So English helps, but they need to have passion. I think that passion is the most important element here. You need to want to share your knowledge, your experience, your message with others. When I see a spark in the eye of whoever the candidate, let's say, then I know that there is a potential there. Yeah. The rest of the things, like, talking in front of an audience, etc., I can teach them. This is what I do. I work with my KOLs on presenting skills and when to take dramatical poses. I'm Jewish. I know how to do drama.
Yeah.
But it's passion is something that you cannot teach. It's either you have it or you don't.
Well, I mean, this industry has attracted a lot of attention over the last 10 to 20 years. It's become very lucrative very quickly. It's in demand. It's glamorous. And I think as part of that, we've potentially attracted people to this space that maybe aren't that passionate, but they've been drawn here for different reasons. So, what do you think about that? And, do you think that we do maybe have an epidemic of providers globally? You're in a great position to see this, who are not here for the right reasons. And where do you think the industry's at as a result?
It's a really interesting question, but I'm not sure if this question is solely related to aesthetic medicine, because I can say the same thing about medicine in general. I mean, there are many doctors that I know that went to practice medicine because their family asked them to, or it was expected out of them because they come from a dynasty of doctors, or and are they good doctors? I don't think that the question is, are doctors that or the healthcare professionals that you refer to are good or not. I think that in general, we have one life to live. I think that one of the key elements for a good life is to be happy. Everyone deserves to be happy, regardless of who they are. And I want people, as I mentioned before, I wake up smiling when I go to work, because to a certain degree, it doesn't feel like work. I really love what I'm doing. I look at you guys during the podcast and I see the smile on your face. I know that you love what you are doing. Exactly. So I think that, if you selected aesthetics and you don't feel belong, shame, but rethink it. Go be a florist or whatever gives you bliss. It is so important. It's important for you. It's also, it's only fair for your patients to go and work and get service from someone who really wants to do it.
That's a really good point. I actually met an injector. So we're not going to give their name away, but she eventually quit after quite a while of injecting, and she just found it a bit too stressful is the wrong word. She was anxious in herself. She wasn't confident with everything that she was doing. Every day she was worried there's going to be an occlusion or a complaint, or, she just wasn't comfortable. And she said, you know what, this isn't for me. And kudos to her for having the balls to sort of change her mind and go back to traditional nursing.
Yeah.
So it's not for everyone. Just like any job's not for everyone. But you're right. You've got to be happy. You've got to go to clinic and be like, wow, aren't I lucky to be doing this? And if you don't feel like that, maybe just ask yourself why.
Yeah. One of my best friends, she is an extremely talented neurologist. But like 5 years ago or so, she realized that, you know something, I went to neurology for the wrong reason. And I really want to do aesthetic medicine. And she is a fantastic injector. She has literally a beautiful eye to see and to treat patients. So she's still doing neurology because she's absolutely brilliant with that. But she's also injecting 2 or 3 times a week. And, you know, as part of maturing, as self-development, we get to learn, perhaps in a later stage in our life, what makes us happy. And the most important thing is not just to think, but actually to act, to do something regarding that. AKA Dean is learning animation now because this is what I wanted to do when I was 14, 15. And I decided to recap the dream.
Yeah, I can relate to that. Who are your mentors? Who do you learn from? I mean, you've got this vast array of skills that you're now imparting onto your young mentees. Where did you get all this from, and who do you go for who do you go to for advice?
So I was very privileged to meet some excellent doctors along the road. Dr. Croma, who's a plastic surgeon, was an amazing teacher for me. His character was, and still is, I didn't kill him, is absolutely bubbly and fantastic. Sarit Cohen, another plastic surgeon, who is a wealth of knowledge. So every time that I want to think of something new that I'm not sure of, she's the person to go. Luisa Velar, plastic surgeon from Brazil, which I had the privilege to work with during my time in Galderma, and perhaps one of the nicest people I've met. So many people. My Peter, he's not a doctor, he's a psychologist, but he is dealing with development and coaching and help others reach their full potential. So Peter Horngacher. There are so many people, but I think that as long as you've got curiosity and hunger, this is what you need. So you will find, perhaps you will not always find the people to learn from, but a certain skills. I'm always laughing that in one of the places where I worked, I was privileged enough to have the worst boss and the best boss in the same session. And I've learned from both of them equally. From the worst boss, I learned the type of boss that I never want to be, which is an extremely valuable lesson. From the best boss, I've learned so many things that I make sure that I implement into my daily routine. So I really think that you can learn from everything. It's a matter of perspective. It's a matter of what do you want to learn. If your idea is to learn every day something new, Peter is always saying, if you feel like you didn't learn anything today, open Wikipedia, read something for 5 minutes. Guess what? You learn something new. And I love this. I think it's such a great philosophy.
Yeah, I tend to stick to YouTube. I'm too lazy to read. No, it's true. I mean, I'm always like searching for knowledge or learn something random.
Yeah. Do you find that people are comfortable asking for advice and sort of, are you willing to mentor them? I kind of feel maybe these days people are shy. They feel like they don't have the sort of interpersonal skills that, maybe we once had and or the fear of rejection. Or...
I mean, look, our Patreon community is a great example of how it can work and should work. And we're going to get you on, Dean. You're going to be part of our Patreon, whether you like it or not.
With all your spare time,
there's a lot of knowledge and sort of vulnerability shared there. But sure, sometimes I'm sure it happens to you and also Dean, people don't want the group sort of watching or listening to those questions, and they'll reach out. But I think, and same for me, I've got mentors and trusted friends and you for certain things. I think it's okay to say you don't know something.
Yeah.
I don't know why people would not want to do that and pretend that they do, because no one knows everything.
Yeah. I don't know. Yeah.
Very true.
Yeah. I don't know. I find that, people are scared to ask these days. I find that. I find that there's
I'm not sure, I think that it's true that today with social media, etc., people have perhaps lost a little bit the ability to connect on a one-on-one level. But still, if something is important to you, you will find a way to ask the right questions and the right people. It's always a matter of how important it is for you.
Yeah, true.
Can I ask you a couple of questions more related to your medical director sort of hat again? So some of our listeners, and most of them are injectors, but there's people like David. David's a good example. When it comes to medical compliance, obviously, the buck stops with you as medical officer or medical director. Like, you've got to be the most compliant person in the industry. So what does it mean? Like, what's on label? What is medical compliance? Because a lot of people get frustrated when they deal with pharma and they speak this very unusual way where they sort of stick between the guide rails and they can't speak outside of that. But what does it actually mean, and why is it so important?
So it's really, every company has a regulatory team. I'm not part of the regulatory team, thank God. However, let's first understand what is on-label, off-label. So every drug or medical device in a different geography has an approval for a certain indication. Now, this approval can be wide or very narrow, but it means that a certain body within a certain country, like Australia, will look into a certain product and will give permissions to use that product on either certain patients, certain indications, certain areas in the body, etc. And why is it? Why do they give this permission? Because it was tested, because they are proved, because there is scientific data to support those claims. The fear is that someone will take advantage of a product and will talk about the use of that product in other areas or other patients, perhaps the wrong one, and to create bad results or even dangerous results. So this is what is on label, and what is not approved is considered to be off label. As a company, we have to follow, as a company who has certifications, Alma has FDA approval for some of the products, and the injectables that we're working with have FDA approval, and so on. CE in Europe, TGA in Australia, etc. The fear is that if you will not follow those instructions, someone will take poorly advantage of those products. And as a company, we really try to follow a very certain line. We want to show that our products are firstly safe, that their efficacy is very high, that they do what we claim them to do, etc. And it can be very frustrating because, let's set aside the medical director role as health providers, okay? Sometimes we know that a certain product plus another certain product will give me a better result, but no one tested it before. What we see is a clinical observation. And based on our clinical observation, and it could be clinical observation done by hundreds of patients, we really believe in it. But as a company is not allowed to talk about it because they don't have enough studies or clinical information to support those claims. So it can be very, very frustrating. Keep in mind that companies, regardless which one, Galderma, Allergan, Prolenium, are only talking about their own products. But we, as physicians in the clinic, we mix and match because we know that this product might be fantastic for the teardrop, while a different company's product will be fantastic for lip, okay? And no one ever tested it. It's up to us, the physician, and it's on our medical license and our responsibilities and liabilities at the end of the day. So it's a very gray zone here. And as a medical director, today with Alma, I'm very fortunate because Alma has collaborations with different companies in different geography. So for the first time, I can test different technologies or different modalities that most likely I would never have the possibility to do elsewhere. Like Alma is working with IBSA on Profilo in Thailand, Hong Kong, India, Israel, or with Prolenium or the Revenes in Australia, in Germany, Austria, Switzerland, UK. So I can try those products and I can try those modalities. And we're actually running super interesting studies at the moment that will create some logic protocols at the end of it.
So can I ask you a conundrum? So you're an injector as well as a medical director, which I guess is quite unusual. I know many medical directors and most of them don't inject. They're the more traditional doctors who work with pharma. But, what if Alma give you a new product and you go, this is pretty shit, but
it happened.
But I have to
I'll tell you,
support the medical director.
As I said, as part of my role, I need to evaluate potential collaborations with other companies. Okay, and I received some royal shit product to try, and I'm obviously very honest. Even though I didn't write royal shit at the report, but I made sure that we will not work with those products. Okay. It's both my personal responsibility to the company, to my patients, to myself. But you know something? I'll be very, very honest. I love this role that I've got. I feel like a kid in a candy store sometimes, that I'm sent to select whatever I want and to try and mix it within the protocols. So obviously you need to know your pathophysiology very well, and you need to know the biotechnology of the products and how it can fit to the current products that we've got. But it's something that I love. I think that it's fantastic.
Yeah. David's sort of, not jokingly, but I think seriously criticized how sometimes KOLs have to go on stage and be very on label, and everything that they say is true and the study backs it, but sometimes it's not very realistic. It's not how we actually inject in real life, like you just said. So how do we kind of make education better when we have to be so rigid with how we do it?
There are a few ways to address this issue, and I'm a firm believer in those ways. First of all, I am employee of the company, but this is why in most cases I bring independent doctors or healthcare professionals to talk, because they will share their own real world practice. You do need to inform the audience prior to this. So either to put a slide that the information that you are about to receive is the information of Jack, and it is your own experience. So you don't talk on behalf of the company, you talk on behalf of but it is allowed. You will see that every company has a slightly different set of rules. Some of them are trying to be more Catholic than the Pope, which is fine. Everyone are allowed to do whatever they feel comfortable with. But I think that as physicians, and you see it like in IMCAS now, what doctors want to hear most, what they care about, is not the on-label indications. They want to know the questions, the burning questions that they get to see in their clinic every day. Yep. Sometimes it's true, as company, there are certain taboos that we're not allowed to talk about. However, if a doctor will ask a direct questions, we have MSLs that can answer even off-label questions. So it's a very tricky scenario sometimes, but there are always ways around it. I'm always thinking about myself before I took over my first role. There were questions that I wanted to know and I didn't know who to ask. So I asked basically everyone until someone was willing or could give me an answer. I didn't stop asking. And this would be my recommendations to the listeners today. If there are things that you want to know, that you're not certain of, ask. Nothing, worst case, you will get an answer. Sorry, we cannot answer those questions. And then you continue to ask until you find someone that will be interested to answer. But don't ever stop doubting, asking, exploring. This is the curiosity that I've mentioned before. It's so important.
What do you think most junior injectors do wrong in the early development?
Learning medicine. What do I think there's a lot of glam around the concept of aesthetic medicine. There is the misconceptions by many, not by all, but by many, that it's an easy field, that you don't really need to learn, that all you need to do is to pick a syringe and that's it. And it's not. There is a proper and deep need of understanding anatomy. There is the most important 3 R's that I see in the industry is respect the anatomy, respect the patients, and respect the product. If you fail to do one of them, regardless of the reason, you will not be successful. So if it's something that you are interested in, and especially today when the borders of aesthetic medicine are really expanding, and today there is the anti-aging that we can talk about in a moment, and the longevity, you need to be willing to invest exactly as it would be if you'll decide to be a cardiologist. It's not an easy stroll in the park. You need to invest. You need to invest your time, your effort, your energy. You need to be willing to understand that no one was born an amazing injector or an aesthetic healthcare professional in a day or in a year. It takes time. You need to learn a lot. You need to be willing to receive criticism. Super important. You need to have a very nice amount of being humble, because even though the chances of a life-threatening conditions with aesthetic medicine are slimmer in comparison to cardiology, but you're still dealing with human beings. You're still taking care of patients. And you need to care. You need to be empathic. You need to listen much more than talk, even though you don't understand it during this conversation, because all I do is talk. But you need to be a good listener.
Yeah, really good advice. Now, we're going to spin the conversation more to sort of actual techniques and products and stuff. I want to get your insight. And one of the most interesting things you said to us when we first met you, that you're playing around with body fillers. Now, that's not something that we really see here in Australia, apart from maybe a bit of biostimulation of the butt or, the knees or the elbows. It's not really taken off in any big way. So what are you talking about? What body areas and what products are we talking about here?
Well, in Europe, obviously in Europe, things are slightly easier than they are in Australia.
You mean?
But I think in general, everything is easier.
Less rules, yeah.
As I mentioned before, as part of my early stage, I had the Sculptra patients with the butt. I love butts. I think it's very important. But I think that body fillers in general has a very important niche, mostly because of the reduced downtime in comparison to surgeries. What you see is what you get, sort of. So there are many elements to the why. The biggest problem that we had for many years was that when you inject large quantity, there is a risk of inflammations, there is a risk of migrations, but it brings you back to the topic that we discussed before regarding the importance of good education, the importance of selecting the right products, etc. Areas where I inject with bodies is, as you mentioned, the gluteal area is a prominent example, whether it's to reshape, to correct, hip dip. And you mentioned that, we can do it with biostimulators. But you also know that with biostimulators, you require multiple sessions, and it's extremely expensive because the product to begin with are expensive. And then when you need to do 4 to 5 sessions, it's very expensive. And they are not as predictable because it's not what you see is what you get. You need now for the patient's body to start produce collagen, and collagen productions may vary between the patients and their age and all sorts of other criteria. So with hyaluronic acids for the body, it is different because once you are pleased with the results, it will stay there. And it will stay there depending on the product for 6 to 8 months. So gluteal is one indication, then hand rejuvenations, even though we can do it with calcium hydroxy, which I admit I do it less. I tend to use hyaluronic acid because with calcium hydroxy, I do tend to see more nodules, especially on the long run. Corrections of the inner arm. And really important indications that I love are correction of irregularities post liposuctions, which is obviously not something that you want to have after a liposuction, but can happen. And then you need to smooth out the surface. Calcs injections, especially in asymmetrical calcs. We know that there are surgeries with implants that you can have, but injections. And so on and so forth. So it's nothing new when you think about it, or at least in Europe, it's not new. It's something that existed for a long time. It's just that our understanding and our education for those products is really improving with time. We know the limit. So how much can I do in one session in order to reduce dramatically the chances of inflammations? You get to understand the product much better, with which products you want to work, what should be the sizes of particles, because for body indications, you need a larger size of particles than you would have in hyaluronic acids for the face. Obviously, in some cases, you need a much more aggressive cannula to inject with. So it's a very interesting product. Today, once again, social media are playing an enormous role in the body imaging, but I'm reminding you that I'm still the prince of saying no. I say no to a lot of patients because I love helping correcting asymmetry, for example. I think it's important. But when patients are coming and they don't understand the magnitude of their request, it is where I stop. I take the time to explain, as always, because I love that. But I want them to understand what they are asking for. And I've learned it from some of the mentors that I've mentioned before. For example, for patients that are coming and asking for a breast that would be unproportional and might cause, problems in the future, etc.
Yeah, it's an interesting one, isn't it? I mean, there was this product called Macrolane many years ago, and for many reasons, it was removed from the market, at least from most territories. I don't know if it's still around. Is it still around, Dean?
No, I don't think so. I think it was removed. But I heard rumors that it is making a comeback with some modifications. So
yeah. I mean, this is probably 2012 or something like that, and it was indicated for breast fillers.
It was way before that. I remember when it was QMed back then. QMed. Yeah, they were bringing it in. I remember I was working at Cosmos at the time.
Yeah.
And I spoke about it on national TV before it actually got in trouble for it.
Right.
But they had all issues. They were using it for the breast, and they had lots of issues with things like capsular contracture, because obviously Tommy put a foreign substance in the body. You had that capsule of starch.
Breast in general is, it's a topic on its own. The reason why Also, the reason why, for example, I wouldn't inject biostimulators to the breast is because nodules is a common side effect. And then if a female patient will have, or a male patient will have a nodule, can you be 100% certain to say that this is a product nodules and not a tumor or some kind of, an oncology formation? And then you have patients that have nervousness for months or potentially more than a year until it will disappear. And this is the last thing that you want to do.
Yeah.
Yeah.
So how does this become even financially viable for someone? Because if you're looking at, 2 or 3 mils in someone's face.
Well,
the production of those products is completely different. Okay. It's not as if you're taking, first of all, a syringe for body fillers is coming with 10 mLs.
Yeah.
And it's not the price of 10 mLs of facial product. Because in that case, I agree, no one would come. I mean, it would be so expensive. So it's companies that really specialize in body fillers. They have the capabilities. The production process is different, and therefore it is cheaper. It's still an expensive product, but not as expensive as 10 times the facial filler that you will have.
I think that's where some of the ridicule comes from, because people go, oh, that must be like cheap crap, because 1 mil of Voluma is whatever, 10 mils of this is cheaper by proportion, so it must be rubbish. I think that's where a lot of the ridicule comes from, and most of the main companies aren't making body filler, not yet. I'm sure.
I will tell you that, as you said, not yet. So I won't share names, but some of the big companies are working on body fillers.
Yeah.
With FDA approval. So it is coming our way. And I think that it's fantastic, because the most important issue to remember is safety before anything else. But once you understand the safety and you can solve the issues that we had, the inflammation, there were cases of chronic inflammations in the past. There were migration. So once you understand those potential complications and you can solve them, there's definitely room for those products in the patients. They are searching for it. They are asking for it constantly. Also in areas where we don't, like breast, for example, they are asking for it. And I can tell you that I have colleagues that do inject some hyaluronic acids to the breast, for example. There are some corrections, especially around the nipple area for patients after lumpectomy or mastectomy, which you want to help to correct the asymmetry. And there are, we do have colleagues that are helping with that. But for example, in those cases, for a very small amount, they will use the facial products where they've got more studies. The body fillers that I've mentioned before have, of course, studies. They are approved in Europe. They have CE mark, but they don't have as many studies as the facial fillers that we're talking about. And this is why it's such an important niche, and this is why it is coming our way.
Can you name any brands, or would we have heard of any of these brands before?
I don't know in Australia if you heard of it. For us in Europe, the Remova is one company. The Forma, this is the line for the body. The Hyaluronic, which has different types of body fillers depending on the consistency of the product. One is obviously a little bit softer, one is firmer. Those are the two companies that I work with.
Gosh. I mean, speaking of fillers, we've seen a pretty drastic drop-off with HA use globally. Like there's a number of reasons for that. Obviously, how long they last. There's all these discussions around migration and the hydrophilic long-term effects and so on. And, biostims have almost become more fashionable in a lot of respects. Just curious what your thoughts are. Are you seeing the same thing across Europe? And do you think this is just a phase and it'll come back? Or do you think it's sort of that sort of craze for facial fillers is gone forever and we're moving on now?
I think that, first of all, it's what you're talking about is globally. It's something that we see in all countries. I'm covering, I have my role is global, so I'm covering Asia and Europe and Australia, North America. We see it everywhere. The reasons are multiple. However, I don't think hyaluronic acid is going anywhere, okay? Because for the specific indications that you need them, they are here to stay. And with the right hand, with the right education, they look fantastic. They look as they were meant to look. It's true, biostimulators have cannibalized quite a lot of the hyaluronic acids in recent years. And there is the movement of we want to look completely natural. And biostimulators are really an instrument to help with that. But I don't think that hyaluronic acid will go anywhere. Patients still need lip corrections, and they still need nose corrections, and they still need lower third, so jawline and chin augmentations or definition. And those are really the right indications to be treated with hyaluronic acid.
Yeah, I totally agree. I don't think it's going anywhere. I just think we have more choice.
Yeah.
And maybe we leaned too much on one product for 10 years and now we've realized, probably shouldn't have done that.
Yeah.
Yeah.
That's the combinations that I've mentioned before. I mean, think about it. That today in your toolbox, you've got so many wonderful instruments. The right way to work is to know all of them. Arthur Swift said once that you need to know how to eat with a fork, a spoon, and a knife, because try eating a soup with a fork. So same goes to needle and cannula. Same goes to, you need to know what's around. You cannot just place all of your eggs in one basket. You can't work with one company because still there's no one company that is perfect. And when the best of our patients is what the goal in front of us, this is what we need to care about.
You spoke about wellness and sort of internal health. What are your thoughts on that? Obviously, I know we've met, you're into your health and fitness and diet and so on. So where do you think that's going, and what sort of role do you think that's going to play for aesthetic healthcare providers in the future?
I think that, aesthetic, the concept of aesthetics is not just how you look on the outside, it's also how you look on the inside, how you feel on the inside. There are things that we know that the skin is a reflection of how our inner body is behaving and acting. And I think it's so important. I love the concept of, the anti-aging and longevity. So and we talked about it last time that we met in Australia, about peptide and about, it's such an important, even though, I'm just about to give a lecture about peptide very soon for HubMed, which I'll tell you in a moment what it is. But when you delve into the studies of peptide, you understand that there are many peptides that most of their studies are coming from animal models. Okay, they have none to very little studies on human, but you see the improvement. You can feel the improvement. Patients are reporting less pain, less sport injuries, improvement in their skin quality, etc. It's again like hyaluronic acid. It's here to stay because peptides is nature. It is, the majority of peptides are either manufactured on its own by our body or fragments of it are, and it's all about communication at the end of the day. Because what are peptides? It is the ability to communicate between certain elements in your body. And with time, we are losing this ability to communicate. And when you inject or use those peptides, you are reinforcing those communication. And we've got so many examples for those peptides. Longevity, everyone wants to live healthier, happier life longer. Or at least I think that most people. But it's really an evolving field that, and today we've got tools. We've got tools to improve our quality of life and to prolong them. I will say, on a small note, let us not also forget all things that we have that really works. Castor oil is such an important. I remember as a child that I was forced to take a spoon, but it still works amazing for your hair and skin. And this is just one example.
Yeah, it's interesting that it's eventually we'll have to be nutritionists and genetic experts and biochemists,
psychologists.
Yeah, we're going to have to learn all these new skills if we're, I don't know whether injectors should be doing all these things. I don't know because, what do I know about biochemistry? Not much. I hated it at medical school. So I don't know. Maybe we'll just work holistically with, the peptide guy and the nutritionist and the whoever under one roof. That's probably the most sensible thing rather than trying to do it all.
Could be, but I'll ask you a different question. When you started being an injector, have you ever thought that maybe you're not the right person to ask that question? Have you ever thought that you'll know what are lasers, that you will know what are radio frequency? Today it goes hand in hand, and this is the normal and natural progress of aesthetic medicine. Have you thought that you will look into hair?
It takes too long. Did you ever think you'd be using ultrasound to start diagnosing potential occlusions?
But it's a tool that helps the actual thing that I'm trying to do, which is injector phase.
Peptide is also a tool that helps you do the actual thing because you can use GHK copper, which helps with skin. Yeah. There are different elements. It's just that the field is expanding constantly, and it's expanding because your patients are asking for it.
I'm saying that, for example, in America, it's pretty common now that clinics who do injectables are doing weight loss medicine. Why it came to them, I don't know, because it's an injection and it's easy to make money. Who knows? But are they really masters of endocrine function and diabetes? Probably not. Those people who are offering it. So you sort of see these allied things that get tacked on to aesthetic clinics that maybe or arguably should or shouldn't. I don't know. And by the way, the people who do offer weight loss medicine, I'm not criticizing you. I'm just saying it's a different thing. It's not really aesthetics, is it? It's different.
I think that as part of saying no, which is really important, you also need to know where you put your borders. Okay, what you are willing to do and bring into your clinic and what you are less interested. Okay, if you are, for example, less interested to do hair, so you don't have PRP, etc., and it's fine. Yeah. No one says that you have to have it in your clinic, but you need to feel very comfortable with what you have. I completely agree. If someone won't be able to explain the mechanism of Ozempic or Mounjaro, then they shouldn't deal with it. Yeah. Completely agree. Same as to Botox. If you can't explain the difference between Botox Dysport and Daxxify, then maybe you shouldn't do neurotoxins.
Yeah. I guess it comes back to just knowing enough, collegiality, having communities of sort of other practitioners. And at the end of the day, if you're worried about your patient as the number one reason why you get up in the morning, then I think it's important to say, well, I don't know, but I have a colleague who specializes in the area, and whether it's within the same clinic or within your community, that you know where to send the patient. So at least they're getting good advice and you're doing what your number one priority is, which is take care of the patient, even if it's not with your own two hands.
Yeah, same in our clinic. We're looking for, I guess, strategy to help women with menopause and hormones and obviously psychology as well. And we aren't the masters of that. I'm not a general practitioner. Women's health, wasn't really my thing at medical school, but we see women every day in our aesthetic clinics struggling with menopause, and both aesthetically, but also physically. So yeah, trying to join these services together that people clearly need is going to be something where I think clinics should be looking at in the future.
Totally.
Yeah.
Yeah. Like you, we refer to other clinics to other colleagues that are doing other things. I think it's very important.
Yeah. You mentioned, you've got the privilege of working with different companies under Alma, and you can, play with new toxins and fillers. It must be quite a cool job. But in your own clinic, what is your sort of toxin of choice? What is your number one?
So when it comes to toxin, I use Dysport or Azalor, depending on your geography. It's my go-to neurotoxin. I also use Botox. I mix and match according to what my patients need. And it's true also regarding hyaluronic acid. So I have multiple companies. My go-to hyaluronic acid at the moment is Prolenium, so the Rebanese. I still have Galderma. I still have some of Allergan. I still have, some products from Filmed. So it depends. Teoxan, it depends. If most of my patients, most of them trust my judgment, and then I will use. I know that you use Allergan in most of the cases. I use Prolenium, so I use Revanese in most of my patients. I do have patients that are coming and asking to be treated with a specific product. Yeah. Either because they read about it or they're used to it and they like the results. And of course, I respect that. I use a lot of biostimulators, mostly Sculptra, so mostly PLLA, Profilo. I love Profilo, Structura. So, and again, it's a mix and match. I don't think I have one patient that is identical to the other. Hence, I don't have one treatment that is identical to another treatment. It's always tailor-made. Of course, all the energy-based devices, the skincare. So,
what are your thoughts on the longer-acting toxins? So, you mentioned sort of Daxxify. So, quite a topical area of discussion at the moment. Are you sort of going
to? Super interesting. Also, it's a toxin with peptide again. I think specifically, speaking to my colleagues in the US, because at the moment it's only available in the US. So speaking to my colleagues, when we look at other companies, Allergan, Galderma, no one really put their fingers before in regards to duration. Okay, we always said the duration will be in between 4 to 6 months. The duration will be in between 3 to 5 months. And then they came with this big announcement about, they put a month. And I think it was an honest mistake, because in medicine, there are no 100%. You cannot come and have a claim that is a number.
Explain to our listeners what the mistake was that they made.
I think that, if I'm not mistaken, they claimed that the longevity is 9 months. And obviously, it's not for everyone. Just like Botox will not be for everyone 4 months or 5 months or 6 months or Dysport as well. And the nice thing is, and I kudos to them, to the Daxi team, that they learned from their mistakes. They adjusted it accordingly. So they are talking about an average. They are talking about what exactly, how would you, when you talk to your patient and you explain to them about neurotoxin, what do you explain to them in regard to the result? Is it no movement? Is what you would consider a result, or is it a decrease in the movement? And that was one of their learning curves in the US. And I think that it's a learning curve that will affect all of us. I mean, all doctors that work with all products, because it is teaching us what should be the right discussion with some of the patients. Because if patients' expectations are for no movement, then for how long can you promise that no movement? Or if the discussion should be with a reduction in the movement, when will they start to see a slight change? Does that mean that they need to come to the clinic immediately during that time? Or it's an ongoing process? So it opened a new opportunity of discussions with the patients, which I love, because again, patients' education is so important to me. So I am super curious to get the Daxi. I don't know what are the plans. I know that it's coming to China very soon, but since I don't live there, I won't get it. But I'm definitely curious to try the product.
Yeah, well, here in Australia, I think it'll be next month after this podcast out, we'll have Relfydess, which is Galderma's, yet another new toxin, which is also longer lasting. So that'll be one that you could try maybe. I don't know when it's launching in Europe, but I think Australia is the first launch in the world. I wonder whether we'll all have like a portfolio of short or very short lasting, longer lasting, and we just sort of pick and choose various, different toxins for one face and just sort of have a portfolio for them. Who knows?
It's definitely so. As we mentioned before, it's an industry that keep on evolving constantly. We have new products, new technologies, new modalities, new combinations coming all the time. And it's up to us to understand them. Perhaps as you said before, if you don't want to know everything or all the different products, and you stick to what you feel more comfortable with, but it's definitely interesting.
Yeah, well, wait till the effect of quantum computers starts to impact aesthetics, and how quickly they're going to be able to run studies. And oh my gosh, it'll just be. I don't think we're even vaguely prepared for what the world's going to look like once this gets into full swing.
Yeah. Last, I guess, question. You must have seen some cool stuff in your R&D lab and behind the scenes. Can you give us any, sneak peeks into completely new technology or something that is quite different to what we already see?
There are definitely, so as I just mentioned, it's a super interesting field. In IMCAS, 2 days ago, in IMCAS, the hottest topic was obviously GLP-1, the Ozempic phase. What people are also talking about is obviously skin laxity, but not just facial skin laxity, also body skin laxity, because when you're losing rapidly a lot of weight, it affects the collagen and elastin fibers. So definitely this is something that we are working on. The downtime, I would say. So we see today many technologies that have beautiful results, but with impressive downtime, pain involvement, etc. And the idea is how can you bring those results to the patients with less of a pain, with less of a downtime. How can you combine the different modalities? I don't like to use the term a cookbook, but at least to help HCPs to feel more comfortable in trying different modalities in order to achieve best results. You mentioned before that I have many hats. One of those hats that I've got is for a different company. It is called HubMed, that is focusing on HCP's education. So the idea was exactly for what I've mentioned before, since companies have the difficulties to talk about combining different modalities that are coming from different providers. But it is something that we do in the clinic constantly. So how can we help doctors gain their confidence and to teach them about those protocols? Jack, you are about to join HubMed as well, as one of an experienced doctor to share his experience. But it's, HubMed Ed is a platform that really helps doctors to gain knowledge and to understand different indications, different combinations, and to talk about things that others are not willing to talk about.
That was a world reveal. By the way, that the most planning we've done for this is over a curry in Australia. So that's as far as we've got.
The best way to do it.
Yeah. But Dean did invite me to do something. So yeah, we'll definitely explore that in the future for sure.
Excellent.
So Dean, we always end these Injector Diaries podcasts with a question from our previous Injectors Diaries guest. So it was Dr. Beta Farrell. She's an injector in California, a great practitioner. And her question was very simple, but very poignant. What have you learned from your worst mistake?
Wow, that's a profound question. Let me think of my worst mistake. I had so many.
Well, you can name the top three if you want.
It doesn't have to be about injector. It could be.
If I give you the three, we'll need another hour. So my mistake was years ago in regards to patient expectations. Okay, I think that as a young physicians, we tend to paint everything in pink. Or we want to paint everything in pink because it is very clear for us what we're going to do. And perhaps this is what brought me into patients' education so deeply, that I allowed the patients to, without even noticing, to stroll on the imaginary dreams that they had in regards to the results. And as you can understand from the story, obviously they didn't get the results that they were aiming to. And I had to take a moment, really to take a step back and to understand what went wrong, but also to reverse engineer everything and to understand how can I correct it. Today, when I'm teaching, and it can be young injectors, but it can be experienced one, I really take the time again to listen to what the patient has to say, and to understand together to what do they mean. Not just I want prettier lips. What do they mean by that? And to take the time to do a step-by-step with them of what we can achieve and how we can achieve that. Because many times we can achieve something that is closer to their dream, but it will require multiple sessions. And many times we cannot fulfill their wish. And it's fine. The art of saying no is, I think, one of the topics that are least discussed within the aesthetic industry. I think we need to discuss it more because we have a responsibility towards our patients. Same goes when you teach other doctors. You need to teach them how to say no. You need to teach them when and where do you draw the line. Even if you believe that you can do something, would you feel comfortable with doing that? The fact that the patient asked is not an enough reason. So that would be my best learning curve.
Mm-hmm. I mean, we've all been in that situation. So if that's your worst mistake ever, you're doing all right.
Oh, you should have seen it before and after.
All right. Okay.
I do have something that I've learned, not from my doctor's role, but from my medical director role. And then that is to not be afraid to be yourself. In one of the companies that I worked, you want to prove yourself, you want to be the best that you can. And I worked, in my opinion, in the worst toxic environment that I've ever encountered in my life, ever. The thing was that everyone was so scared of the boss that we had, who was a very powerful person, that no one was willing to open their mouth. And I was, I'm saying it, I was the same. I was afraid to open my mouth. And you know me a little bit to know that it's quite rare for me to open my mouth. It took me a while to open my mouth. I did it eventually. And the best advice that I was given and that I had to reflect to myself is never forget and to lose who you are in the process. So we all have dreams. We all want to reach from point A to point D. We all want to develop and to fulfill our dreams, which is fine, but never lose yourself in the process. It is so much more important to work in a good, healthy, supportive environment, which might not be in the dream company that you had, but that will feel right, to find the balance of your happiness. I've mentioned before about how everyone are entitled to be happy. And I so believe in it. I am today in a much, much better place than I've been even 5 years ago, because I found the right people that I want to work with, because I found the people that I respect and that respect me, because I am waking up with a smile on my face and I'm doing what I love and what I'm super passionate about. Don't lose it. Don't ever lose it.
Yeah, such good advice.
Yeah, thank you for sharing.
And finally, Dean, what is your question for our next Injector Diaries guest?
What is their bliss within the whole concept of having a family life, having a clinic, having, whether they are medical directors or not, what is their balance? I mean, if they would have to create a recipe for a bliss, for a joy, which percentage would it be and why?
Okay.
I know what is mine. Okay. I know how, and the time that it took me to find this balance, and it took me a long time. I am very bad with not agreeing to a new project, but it took me a while. For me, it was Peter that helped me, June that is crying outside of the door because I don't let her get in. But I think that it's super interesting.
Yeah, okay. Well, we do know who our next guest is, but we're not going to tell you. But we'll see what they have to say. Well, mate, I've had a lovely time catching up again and getting to know even more about you. Any plans to come back to Australia this year?
I'm coming next month.
Ah,
whereabouts?
That's a surprise.
To Sydney?
Yeah.
Yeah, surprise. I'm coming on the 15th. I'm coming for 10 days this time. So hopefully, David, I'll be able to see more than from a distance, the open house.
Yes.
I'm coming on the 15th of March until the 25th.
Okay.
And I'll have 6 days in Sydney and 4 days in Melbourne. My first time in Melbourne.
Right.
So we have the official launch of the Prolenium products in Australia, in Melbourne, with loads of workshops in Sydney and in Melbourne. I'm coming with 2 colleagues, so 2 doctors, Dr. Maya Sinai, who is a dermatologist, and one of the funniest person I know in the world. And being on stage with her will be a hoot. So don't miss it. She is as insane as I am. And Professor Phil Artsy that you met in Thailand will also come. And so we will have loads of time. Of fun times, and I think that I'm also coming back in June to Brisbane.
Excellent.
That'll be a lot of fun.
Next time when you get here, Tal is not allowed to choose the restaurant anymore. Actually, you chose that one. Did you choose that?
Well, okay. So we spoke about Indian food when we met Dean. I don't know how or why we got talking about Indian food, and both Tal and I agreed that was the best one in Sydney.
Well, if that's the best, I don't want to taste the worst.
Are you serious? you like the food, didn't you?
You loved the hat, didn't you?
Oh yeah, the birthday hat.
Yeah.
It wasn't David's birthday, but we got him the birthday hat.
I love somehow managed to get lice and I don't have hair. So
no, I'm with David. I would prefer a different food.
Okay,
fine.
All right, I'll choose the restaurant. I've got you covered, Dean.
Please.
So we're going to
like a protein-based.
Yes, don't worry, I'll sort you.
David has a favourite restaurant. It's very nice, but
I've got a few. I think they could go to Gidley.
I think Gidley or Bistecca.
Yeah.
Anyway, we will sort that out, Dean. But thanks again. Thank you for your time, and stay safe. And we'll see you soon.
Thank you so much.
And
go to bed. I think it's really late, isn't it?
Soon.
It's not too bad.
Get in there.
Yeah. See you later, mate.
Thanks.
Bye-bye.
Bye-bye.
For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics.
Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.